So what will happen to the aortic stenosis? Please, you can type the answer. Ejection systolic? Yes, ejection systolic murmur. Systolic, because as I told you already, whenever we are talking about murmurs, systolic or diastolic, we are timing with the ventricles only, left ventricle. So when left ventricle is contracting, systolic, no. When left ventricle is contracting, because of there is a stenosis here, there is a turbulence here, the systolic murmur. So you get a murmur here. Ejection systolic means like that. This is a mid diastolic and this is ejection systolic murmur. This is ejection systolic murmur. If you want to confirm this, and this ejection systolic murmur gets radiated to, this aortic stenosis ejection systolic murmur gets radiated to, answer, type the answer please. Carotid is the right answer. And the MS, the mid diastolic murmur of mitral stenosis gets radiated to Sadat and Arbas. Mitral stenosis, mid diastolic murmur gets radiated to. Okay, when we talk about mitral incompetence, we'll come to mitral incompetence. This is aortic stenosis. So we spoke about MS and AS. Now let us talk about MR, mitral regurgitation. We don't use the word mitral incompetence, we use mitral regurgitation. So we discuss about mitral stenosis and aortic stenosis. Now we'll go to mitral regurgitation. Again, this is mitral regurgitation. In regurgitation, the hemodynamics are just reverse of stenosis. The valve opening is too big. The valves are not opening like that, not closing like properly. So when the left ventricle is contracting, these two cusps are supposed to close the opening. So they are not closing. So they go inside like that. They go inside like that, and the blood tries to enter in a reverse direction. This is called mitral regurgitation. So what murmur do you hear in mitral regurgitation? That is a question for you. What murmur in mitral regurgitation? Again. Pansystolic murmur. Is it in the systole or diastole? Anyone say systole or diastole? Is it systolic or diastolic? Arbas? Because ventricle is systolic, ventricle is contracting. So because of the loose mitral wall, the blood tends to go back in the reverse direction. So it is a pansystolic murmur. So you get a murmur like that. The whole systole is murmuring. This is PSM, or you may also call it as a holosystolic murmur, pansystolic or holo. The pansystolic murmur is a hallmark of mitral regurgitation. And sometimes when there is a ventricular septal defect also, you get pansystolic murmur. Rarely. Because again, same mechanism, the ventricle is contracting. So during the contraction, any murmur during contraction is naturally systolic murmur. So this pansystolic murmur of mitral regurgitation gets radiated to pansystolic murmur of mitral regurgitation gets radiated to, please type. Left axilla. Left axilla. Left axilla is the right answer. So whenever you are hearing a pansystolic murmur in the mitral area, and I'll tell you what areas of auscultation when we are taking the practicals next week probably. So if this pansystolic murmur gets radiated to your left axilla, the diagnosis is almost certainly it is a mitral regurgitation. So then what?
Hello, 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 hello. Hello.
Hello? Can you hear me now? Can you hear? Yes. Go direct. Right, this is the aortic regurgitation. So same thing happens whenever there is a defect in the aortic valve, the blood from the left ventricle goes, when it goes up in the systole, it will again come back into the diastole. So what murmur do you hear here in aortic regurgitation? Anyone can type. Diastolic murmur. Aortic regurgitation, because the blood tries to come back into the left ventricle. So when left ventricle is relaxing. So in aortic regurgitation, you have a diastolic murmur. Aortic stenosis, you have a systolic murmur. So this is about mitral stenosis, mitral incompetent, mitral regurgitation, aortic stenosis, aortic regurgitation. Now you can imagine the tricuspid stenosis and tricuspid regurgitation, pulmonary stenosis and pulmonary regurgitation. I will not explain this, you should tell me. Okay, now it is pulmonary stenosis. What murmur do you hear?
Ejection systolic.
Pulmonary stenosis. Who said ejection system?
Ejection systolic.
Pulmonary stenosis. Left, right atrium is finding it difficult to pump the blood into right ventricle during. It is just like your mitral stenosis, isn't it? What is happening here? The same thing should happen.
You mean tricuspid stenosis?
Tricuspid. What did I say?
Pulmonary.
So sorry, this is tricuspid. Pulmonary summary. Sorry, the tricuspid. This is tricuspid. Your left atrium is not able to pump because the tricuspid valve is stenosed. It is finding it difficult to enter the right ventricle. What murmur do you hear in tricuspid stenosis? Diastolic. And tricuspid regurgitation? Systolic. Okay, come back to right pulmonary valve. It's not here. It will be somewhere here. Like pulmonary stenosis. What is the murmur? Okay, pulmonary regurgitation. What is the murmur? Okay, is it simple? Understood everything? You should not get confused. I'll tell you once again when we are talking about clinical medicine.